Okay, well, hey, good morning, everybody. This is Dr. Bulow with Revive Upper Cervical. And, all month long, I've been meaning to do this video. It's a whiteboard discussion I've had in the clinic. Over the summer months, we talk about Revive Women's Health, and we talk about Revive Men's Health. Those are hashtags you can look up. In Revive's Men's Health, we tend to talk a lot about structural issues, neck pain, shoulder pain, back pain. And today I want to talk to you about sciatica. So if you know someone in your life that's dealing with sciatica or is always complaining, they're always going to the chiropractor, going to the physical therapist, this might be a video that would be of value to them. Feel free to share it. Feel free to ask questions. And even share it if you don't know someone dealing with this. You just never know who may be dealing with these issues. So with that said, let's talk about sciatica. Kind of an interesting name, sciatica. It's named after the nerve, the sciatic nerve. The nerves are what tell your brain what's going on. And the sciatic nerve is the nerve that helps your brain communicate with your lower leg. And it starts from the nerve roots in your lumbar spine, in your low back. Those nerves come together and form this great big nerve called the sciatic nerve. One of the biggest nerves, if not the biggest, thickest nerve in the human body. Pretty big nerve. And what happens is it comes out from a little inner space between your sacrum, the bone kind of at the base of your spine, and your ilium, your hip bone, the bone that you sit on, your sitting bone. And it comes through a grouping of muscles. It kind of comes out of this little pocket there and goes down the back of the leg. Now, a couple things can happen. If someone has a irritation on that sciatic nerve, you're going to get, first of all, a lot of nerve-based symptoms. When you talk about nerves, you talk about numbness, tingling, pins and needles, and unfortunately, pain, shooting pain. Now, if someone has pain, it could originate in the lower back, but very often you'll have it kind of right deep in the butt muscles. You'll have this sharp, burning, searing pain, and it'll tend to travel down the back of the leg, down the back of the thigh. It can go all the way down into the calf and all the way into the heel. It can be really, really painful, or it can be a dull toothache. There's a variety. We've seen it all. Now, what do you do about sciatica? There's a couple different things, and it really depends on what's at the root cause of it. That's why it's really important to see a professional. They can kind of diagnose and see a chiropractor, physical therapist, things like that. Someone who's going to get in there and try and find the root cause of your particular problem. But from my observation, most people will first address the muscles, the soft tissues. They'll do these stretches where you can take your knee and bring it up to your chest and give it a nice bear hug to kind of stretch the hamstring. Or they'll grab a hold of the shin bone and give that a nice stretch. When you grab a hold of the shin bone and kind of pull it across your body and give that a nice stretch, it really stretches that piriformis muscle, which a lot of times is crimping that sciatic nerve. But what we have to ask ourselves is, why are the muscles in spasm in the first place if that's what's causing the problem? And to that, we look at the balance of the spine and of the hips. Because if the spine is misaligned and the hips are misaligned, not only can it irritate the nerve roots that actually form the sciatic nerve in the first place, but it can cause these muscles to become overworked. So this is definitely something to look at if someone is stretching and having massages done and working on the muscles, but they're still dealing with this sciatic pain. We probably are dealing with a spinal and pelvic unleveling or misalignment or imbalance. Spinal misalignment is something that can happen over years. And typically what we find is that there are accidents and injuries that tear loose the connective tissue of the spine, leaving the spine in a misaligned state, where when you're standing, the head will tilt to one side, one shoulder will be higher than the other, and as a result, yes, one hip will actually be higher than the other. And that can create a lot of pressure, pain, tension, inflammation. It's a lot of responsibility for your pelvis, your sacrum, and your ilium, your hip bones, to hold your whole body upright. A lot of times when we talk about posture, we don't really think about it, but it took you a year as a toddler to figure out how to stand upright against this thing that we call gravity. We have to stand nice and tall. But over the years, if we have these accidents and injuries, the tissue can actually tear loose on the spine, and the spine kind of breaks down in this misaligned state. And now, yes, we get neck, shoulder, back, hip pain. And if it's bad enough and it hit these nerves, one of them being the sciatic, we can have this sciatica down the back of the leg. So here's the deal. If you know someone who needs a professional look that's dealing with these issues, please let me know. If they're in the greater Pittsburgh area where our clinic is located, we'd love to be able to help them. If they're outside of our region of the world, we'd like to connect them with someone who can help. So thank you for watching this video. But if that's you, or you know someone who needs to be connected with us, we'd love to help. Please share it, please engage, and we'll see you next time.